Hello, everyone. My name is Mishra Gupta, and I am your host for today's podcast, Win Over Hypertension, where you can learn how to take care of your blood pressure through exclusive insights and practical advice. Today, we're talking all things about hypertension, why is it caused, how it matters, and most importantly, how to take care of it effectively. So, doctor, by now we all know what hypertension is. But can you please elaborate on it? I mean, why is it so important for us to take care of ourselves even when we feel fine?
We all know that high blood pressure or hypertension is an important medical disease which is very common, and it should be addressed in general population. We have to understand why we should check our blood pressure regularly even if we are feeling fine. That means we feel healthy, we don't have any complaints. Why should we regularly check our blood pressure? Because you may be having a very high blood pressure, but you may be feeling healthy and you may not have any symptoms.
Okay, but why is it so often called the silent killer? What makes it so dangerous over time?
Why is it called a silent killer? Because as I said, blood pressure can be very high, but you may be feeling normal. It's just like a fire on the other side of a wall. You are standing on one side of wall, on the other side of wall there is a fire raising, but you are not seeing smoke. That does not mean that fire is not there. Similarly, your blood pressure can be very high and you may not be having any symptoms. So you must check your blood pressure regularly so that you are aware when your blood pressure is high and you get treatment for it.
So, doctor, I would like to know what are the most common reasons people develop high blood pressure?
Blood pressure is divided into two types, primary and secondary. So primary hypertension is the commonest variety of hypertension. It is in about 90% of the people or patients. There is no specific cause of developing high blood pressure, but it comes to you through your genes, that is your parents or your siblings, even your grandparents. Your genes, their genes or your genes were having high blood pressure and they have come to you through those genes. But it is precipitated by climatic or environmental factors like high stress levels, like faulty diet of eating too much of saturated fats or eating too much of salt, lack of exercise, smoking, alcohol abuse. Things like that can precipitate high blood pressure. The secondary hypertension is the less common variety of hypertension, in which there are hormonal or endocrinal or renal causes of high blood pressure.
How is blood pressure exactly diagnosed? When looking at the blood pressure readings, can you elaborate on the exact numbers people should be looking at?
One must understand that any BP higher than 130 upper side and 80 lower side is high blood pressure. How often should you check your blood pressure? If you have high blood pressure and it is well controlled, stable, you can check it 2 times or 3 times in a week. That is more than enough. But if your blood pressure is high and unstable, fluctuating, you must check blood pressure twice daily, in the morning and in the evening. While checking your blood pressure at your home by your electronic BP instrument, you should be in a room which is quiet. There should not be any talk in the room, no laughter. TV should be off, the phone should be off, and you should be breathing normally. There should not be over ventilation. You should not hold your breath.
So, I would also like to know, if someone has just been diagnosed with high blood pressure, what are the changes you would want them to make in their daily routine?
High blood pressure is fairly compatible with a normal healthy life. If you regularly take your medication, if you alter your diet, if you reduce your stress level, if you take less of salt, reduce smoking or stop smoking and alcohol, your lifespan will be as of a non-hypertensive patient. You live fullest life and no complications will occur to you. The medicines you are taking for high blood pressure are very, very safe medicines. They have been designed to be taken for lifelong periods. You have to reduce your salt and you have to eat more of salad, more of fruits, and more of green vegetables, and less of oil and ghee and fried food. This type of diet reduces high blood pressure. Then we must exercise daily. Ideal target is 30 minutes of physical activity daily, at least 5 times in a week. We should stop smoking, we should cut down or stop alcohol, and we should be doing yoga or meditation, and physical activities like sports also help.
Okay, I have a question related to that only. Let's assume that somebody's blood pressure is coming under control. Can they come off medication, or is it a lifetime commitment?
You have to regularly take your medicine, and you have to modify your risk factors, like you have to reduce weight, you have to cut down on salt, stop smoking, stop drinking, exercise regularly, do yoga and meditation, and see if your blood pressure is well controlled, then your medicines are likely to be reduced gradually. And even if with the reduced dose your blood pressure is well controlled, medicines can be stopped, especially in a setting of a factor like very high obesity. Somebody is seriously obese. If he cuts down his body weight to normal, most likely his blood pressure can be controlled without medication also.
Okay, when you say reassess regularly, how often people should check their blood pressure, and what's the best way to do it right?
We have to understand why we should check our blood pressure regularly, even if we are feeling fine. That means we feel healthy, we don't have any complaints. Why should we regularly check our blood pressure? Because you may be having a very high blood pressure, but you may be feeling healthy and you may not have any symptoms. That is why after age of 25 years, everybody should check his or her blood pressure regularly every 3 months, and in people over 35 years, every month blood pressure should be checked.
I would also like to know what would happen if high blood pressure gets untreated for years.
If we don't control our high blood pressure, what complications can be caused by high blood pressure? There are very serious complications of continuous high blood pressure. Number one is heart disease in the form of either heart attacks or heart failure. Second is brain strokes. More than 59% of brain strokes are related to high blood pressure. Then vision loss can be there, or either temporary or permanent. Very severe vision loss can be caused by persistent high blood pressure. Then kidneys may be affected, leading to kidney damage or even kidney failure. Then aneurysms may develop in your aorta or other arteries, and other comorbidities are, you become more prone to other comorbidities like diabetes or thyroid disease if your high blood pressure is continuous.
So this marks the end of our podcast, Win Over Hypertension. I would like to say a huge thank you to the doctor for sharing such valuable insights to us. Remember, hypertension isn't just a number, it's a signal. And with right knowledge and action, it's absolutely preventable. If you found this episode helpful, do not forget to like, share and subscribe, and share your valuable insights with us. Always remember, stay informed, stay proactive, and most importantly, stay healthy. This is Mishra signing off from this podcast, Win Over Hypertension.